of y'all Portland. Some of you all Portlanders I see sitting in your lovely homes or at your offices, and I miss you dearly, and I wish you were here in person with us. So
we're not judging.
They aren't. I'm judging a little bit.
I'm totally being sarcastic.
So, okay, sorry, get us back on track here. We got the recording back up. Got the shared agreements. Do we have the air slide?
Yes, we do.
Perfect. As you all know, we use the GARE tool. GARE is the Government Alliance on Race and Equity. Requires us to ask the following questions when we're making decisions on policy, program, or budgets. You've got those in our consensus slide as well. But those 4 questions: what are the racial equity impacts of this decision? Who will benefit from or be burdened by this decision? Are there strategies to mitigate any unintended consequences? And is completion of the full racial equity worksheet warranted? All right.
All right. Next, we're going to hear from Heather Howard. She is out of the Columbia Gorge System of Care. She's going to highlight some of the work that they're doing out in the Columbia Gorge. So go ahead, Heather.
Hi, can you guys hear me?
We can. Do you mind if I pull down the slides and just like spotlight you?
Yes, that would be great. Hi, all. I am from the Columbia Gorge region, like they said, and that means that I facilitate the systems of care in Hood River and Wasco County. And I'm realizing it would be really fun to have a cool graphic, but I didn't bring anything. So you just get my face and spotlighted, which is even better. So let me start by just talking about some of the priorities that we're working on. Our region's top 3 priorities are housing, especially for families and youth. And we've been talking a lot about transitional housing and what that looks like in our area. And of course, like so many areas in Oregon, we just have such a crisis and not enough housing available. Another priority area is student mental health, or really having a need for resources for youth in crisis in our area. So youth who need access to something in the moment, and we just don't have enough access to resources. And then something that's been really interesting is the mental health assessment process has come up several times as a barrier to accessing care, both from youth and from family members, just talking about how challenging it can be to go through the process of telling your story multiple times just to get access to medications or just to get a provider on board with you. So that's something we're really working collaboratively to see if there can be a community way to really solve that problem and access care. And so we're still actively working on those, but some great accomplishments we've kind of come up with in our area is a barrier that I really felt was pretty cool that was submitted. Not cool that it was a barrier, but cool that we've worked on it to find a really out of the box resolution for it, is that we had a community health worker to the Native community present a barrier to getting access to bringing propane on public transportation. So a lot of families in the Native community are living on in-lieu sites, and those in-lieu sites don't have electricity or other utilities. And so they usually use, and they tend to be living there. They're supposed to be only living there during fishing seasons, but it tends to be that with our housing issue, they have no other choice but to live there year round. And so they're using propane to heat their trailers as well as cook their meals. And so the fact that if they didn't have their own form of transportation, they could not fill a propane tank and then take it on a bus was a huge issue. And so a resolution that we came to that we had no thought, we thought that we'd find ways for public transportation to say, okay, but instead, as a community, we came up with connecting with with propane distributors to see if there would be an area where they would fill propane tanks, and then a community member in the White Salmon area, which is not necessarily on the Oregon side, but this community really connects on all sides of the river, each river. Um, he offered his barn for a storage space for all of the propane tanks, and so it's a lot easier for people on in lieu sites to get to that barn, and our community health workers now deliver propane tanks when they go and make visits. So it's been a really cool success. And then another accomplishment we've really worked hard to do is to identify a better system for barriers to be submitted. When I first started, we were kind of taking every barrier that was submitted, and we were finding that it was mostly grievances against other agencies and and just challenges for an advisory level or even executive level to resolve. And so we have a voting system for a small subcommittee of members of the advisory to see if we should accept it. And if we don't accept it, what's the next step? So we all have to kind of take some accountability and work with that family to get connected to the grievance process with another agency. And then recently, because we had accepted so many barriers and we weren't really making any headway because they weren't necessarily appropriate for advisory or executive, we had another subcommittee come through and we really took some time to revise our barrier list. And the questions that we asked this subcommittee was to define this barrier as you see it from the story that's being told with the person that submitted the barrier. Talk about what the impact to the community is. If this barrier for community wide? Is this barrier a small community? And then once we would work through those and have a lot of good discussion, we would decide if we were going to revise, remove, or retain it as is. And so that's really helped us to kind of get to those 3 priority areas that we were talking about earlier. So that has been a lot of fun to be a part of those subcommittees, because we dive in much deeper than some of our monthly meetings can dive in. And I feel more informed and able to go to my SOC meetings with a lot more information too. I feel like we are in line with SOCAC because we're leaning into that prioritizing of the community collaboration. I think the community impact is huge, and we are a very small rural area, and we know that what works for us might not work for another area. And so we have to put our heads together and really think about things as a community, not just one agency taking on the things. And so I think that is in line with SOCAC. And then in our area, youth and family engagement is several different advisory councils. So we have a youth advisory council in North Wasco and a youth advisory council in Hood River. And we bring the barriers when appropriate to the both of these. We bring the barriers to the YACs. We call them YACs. And then we also have a parent leadership committee that really is in line with our Family Support and Connections program. It's already built into the programming. And so then we've started to utilize them to get family voice because they're already actively participating in programming. And so they are contributing. I will say, we're finding that our systems of care time is a barrier for youth and families to be involved, because we do it at 9 a.m. on the second Thursday of the month. And that is a lot of times when youth are in school. And I think we'd get a lot more youth involvement if we were after school hours. And then I think that if youth are coming, I think the families will come as well. So it's something that we're talking about. And as we are building in the new strategic plan from you all, that will be a part of our strategic planning too, is how do we change this to be a better fit for youth and families? But it is great to get their voices at their YACs. And I think that that's kind of a comfortable space for all of them as well, and their parent leadership meetings as well. And then our relationship with schools is fabulous. We're really lucky. We have what we call youth outreach workers, and some of the youth outreach work is funded through the OHA SOCAC funds. And so that is a person who is a community health worker who is an expert at working with youth. and is connecting students who are kind of just those that might be slipping through the cracks or really in obvious need. And so our youth outreach worker works with them one-on-one to get connected to the resources that they need. And then we also have, through the next door, we have therapists that go into the schools. So really if we didn't have the relationship we have with the schools, we would not be able to meet kids where they're at. And that's really important to us, is to be there on site where they're spending most of their day. So access to schools is pretty great for us. And then I think a couple of committees that the school district is actually putting on, and we've been a big part of, is the North Wasco Wellness Committee. And that is the superintendent wanting to really get all of the providers in the area together to talk about student wellness and how we can improve that. And then Hood River is currently doing some assessments on attendance and whatnot. And so we are at that table too, and putting in our community voice there. So that's been really, really great. And then the last question I have on my thing here is what do I think I have in common with other regions of the state? And I think that we all have in common that we would like to be out of a job and have all of these all family needs taken care of. And especially now, we want youth and families safe and cared for. And so we are absolutely working hard to get to that, and would be a dream if we didn't have to ever worry about youth and families in the system again. So that's all I've got. If there's any questions, I'm happy to answer.
Does anybody have questions for Heather?
Heather, I'm just really impressed by addressing folks where they're at with the propane. I think that is so important, and also your relationship with the schools to ensure that there's the connection with the family. So thank you so much for that.
I'm turning around to smile at you, Heather, but you don't know that you're behind me. Here's your smile.
I can see your ponytail. I guess I can scroll to your
Yeah, you can tell who it is.
Yeah.
Thank you so much for being with us today, Heather, and kind of grounding us in the work that's happening at the local level as we really think high level and what is our statewide strategy, making sure that it's relevant to folks like you and helps move the needle for the folks that you are working so hard to serve. As a really great opportunity to ground ourselves. So thanks for helping us with that. Thanks.
Yeah, and thank you all for doing the work that you do. It's appreciated.
Such a light. Thanks so much. And I don't know next on the presenter's agenda. I usually have it in front of me, but not today.
So next up, we have our wonderful facilitator, Addie, who is going to help us for the next hour and 15 minutes walk through strategic plan.
Hey, I'm leaving on the slide. I don't know why. It's like I can't talk about this in my sleep, and we all know that I could. So we have some big steps ahead of us today. Big, broad overview. We're going to re-ground ourselves in how we got here. We're going to talk about the amazing documents that you got last week, or maybe you don't think they're amazing, and then we'll talk about it that way. And we are going to start with the one that looks like this, online audience folks. That one's what we're going to deal with first, to the extent that it's helpful and it's the strategic plan. Then we'll move to that big, overwhelming spreadsheet. So you'll need access to both. Those of you in the room, we've got copies here for you, although you're welcome to pull them up. Those of you out in the cyber world, you're on your own, but we did send some emails with them. And then, so we're gonna go through how we got here. A little bit of a roller coaster. This is an exciting one. We're gonna talk about the strategic plan. When I say that, I mean the Word document that I just awkwardly flashed in front of the camera. We're gonna see if we're ready to give that the final thumbs up and move it into official public comment. Then we're gonna turn to, and this will likely happen after our 2:15 break. I have really big notes for myself about the break, so don't worry. I'm ready to roll today, I'm sure you all can tell. Then we're gonna turn to the working portion of our meeting, and we're gonna have some breakouts in the room, some breakouts online. We're gonna trigger the implementation plan and get situated in its first iteration. So that's gonna be something you all are gonna be working with, hopefully on the regular through the next 4 years. So that's kind of the overview. I think I have some slides to go with me, but if not, I'll just start rolling.
Let's see.
Okay, so let's pause before we get into the goals and process measures and all that good stuff. How did we get here? I have never in my life worked with so many documents and people to create a strategic plan. So I'm just going to remind folks that I started working with all of you way back, probably very close to January. There was, like per usual with state government, some contracting hiccups, but you've had the joy of now knowing me for almost 10 months. We've made some best friends in the process. We've had some good times online and otherwise. Like any good process, there have been some tense but important moments, and we've worked through them. But we really started with a great foundation of information to get here. So as much as I'd love to take credit for this awesome work, none of this is mine, right? All I've been is sort of like the one that has collated all the information that all of you and many community partners and many youth and family partners and many other agencies and many other individuals who have looked at how children are or aren't served in Oregon over the years. So Christy sent me and all of you, I want to say something like 35 documents, which came out to like 980 pages of material.
Sophia might actually know.
Read everything.
So I took all of those. We worked with the strategic planning core team, and I think we learned some things, and there are ways we may do it differently in the future, but we did direct some community outreach through some strategic community partners who received micro grants. Oh, thank you. Who hosted a series of listening sessions. So we ended up with a voluminous amount of notes from that have been incorporated into here. Our amazing youth and families, through some coordination with one of the team members, had their own meetings where they not only took a look at each of their individualized engagement plans, but went beyond that to create a series of things that were most important to be put into the plan to begin with. And then, as you might recall, you've seen me pop up on like every meeting we've had since January, and that wasn't enough, so we had a 2-day retreat. So all of that was sort of the ingredients for the recipe that is this, right? So we took all those puzzle pieces, and you'll probably remember for those who joined the meeting, the 2-day retreat, the first day we came in with a lot already on the table because of all that pre-work we had done, all that background Christy forced me to read, all of that information all of you had gathered, right? And then we spent a lot of time validating, rearranging, rewriting, rethinking, and you were all super sick of me because all I said over and over at that meeting is, what's something we can do? What's an action we can take? What's a bite-sized step? Like, the joke of that meeting was sort of, we're not ending racism by 2025 because we know there may be a strategic plan out there unnamed that did that. Unnamed. And I'm here for that goal. I just want us to pick realistic things, and I think we want things bite size. That's a bite even bigger than I can take, and I've been told I have a big mouth a lot. So I took all of that and chugged it through and processed all of it. But that wasn't enough either, right? Then we really leaned into your current subcommittee system, and we let your experts help us in the areas where we wanted extra review, more eyes, a double check, an addition, etc. So we went through the GARE analysis, and our DEI team here took a look at that. We pulled back out the values from the strategic plan, and we had the core team walk through the strategies, making sure that they were aligned with our values. We called in the youth and families and had special meetings with youth and families to set the priorities that would lead the way on this, right? The really hard work of saying everything in this implementation plan, everything in this strategic plan should all happen tomorrow, and it should be all done by Tuesday, and yet we have to pick some priorities. We came back to you at the last meeting with a lot of that and said, here's the strategic plan. the tofu and broccoli or the meat and potatoes, depending on who you are in this group. I know we like both of those terms equally. But now you have in front of you sort of the end all be all, and it's time for our last big discussion after all of those pieces that got us there. The only thing that you should, so I'm gonna make a couple notes, but the only thing that should have been sort of, I don't even wanna say brand new to you, because you've been a part of SOCAC and the process, but the only thing that you should have been like, oh, I haven't seen those words in that order on this page would be what, with my lawyer hat, and you can make fun of me later, I would call is the front matter. So the front matter is before we get to page 17 called the framework, right? And it's those sections that are the letter from our fearless leaders, the executive summary, the background, the context, the purpose and the process. Now, even the purpose and the process shouldn't feel new to you because, as you might remember way back in February, that's what we worked out together. Does this process look good? Do people have concerns about this process? Is this why we're doing it? Are we doing it just because we have to legislatively, or do we actually give a heck about it? All of those things, we had those conversations, but I did memorialize them here because for those of us who didn't get to hang out with me for the last 10 months, we want them to know that this wasn't Addie in her office alone in a day that just wrote this up for funsies and put it out there so you guys could check the legislative box.
Which would have been so much easier, y'all.
On all of you, but not on me. So that's how we got here. Thoughts, comments, what did I miss? What did I not talk about? I know one of the things I really appreciated is the utter dedication and support from the SOCAC team. I also think we've all been very intentional throughout this process in noting what has worked. We've had to redo some things when it's been necessary, and we've also made some notes about next time, how do we do some of this better, right? We're all gonna make mistakes, but what you can do with a mistake is beat yourself up forever and you're not perfect. I learned that's not true, that doesn't work well. You have to learn from that mistake and do it differently next time and offer yourself some grace in that moment while also taking accountability. So that's what we've really been focusing on our staff time about, is both keeping the project moving forward, but learning how to do better next time from the experience. So.
And in that regard, is there anything that, like, when Addie just said what she said, were you like, hold on, I need to put this on the list of like things that I love, we need to hold on to, we totally kicked butt at that, or we gotta do better next time? You don't have to have the answer of how we do better, but if there's a thing that just popped up for you of like, and she's talking about this thing, let's make sure that this thing is on the list. You can raise your Zoom hand. I see Emily Cooper's got her hand up online.
Thanks for help.
The things I think we did really well is all of the feedback we got. We weren't, it wasn't just Addie's office or our own little echo chamber. I really love how broad it got. I especially love that there was a family and youth just stand apart. And I know it was sort of by time, but I love that the locals weighed in early. And so I just think it is complicated, but to me, this is like, I've never done a strategic plan like this, and it's been really inspiring. And Addie, I think you've been doing a really great job at it.
Thanks so much, Emily. Anyone else?
And if now isn't the forum you want to bring it up, by all means, shoot me an email or Anna or email, or ask for 5 minutes on break or otherwise. Always wanting to do better. Oh, yes, we should jump in.
Clarifying question.
Of course.
Comments or questions about the process itself, or comments or questions about the first?
Right now, process. We're going to move to the document in just a second.
Okay. I would echo the involvement of family members or folks with lived experience. And I think that was a really thoughtful process overall.
I'm glad to hear that. We tried.
Okay, invitation still stands to send to anyone who you feel comfortable with feedback. Elliot, I know, is also with us for portions of today. They're open to emails too, if that's the person you feel most connected to, by all means. They know how to reach me at all hours of the night, etc. On that, I am going to move us into the document. I think, we have We should go back a slide just to make it less confusing for people, so I'm talking over the right slide. Sorry, Christy, I'm just like stealing your thunder.
There you go, perfect.
That's fine. I can just talk over my name. One time we'll talk about how I got in trouble for doing exactly this, but on break. Okay, so, what I would like to go over very briefly, and we'll have Christy jump in on one of the puzzle pieces, and then we'll move exactly to where I think Alicia is headed. Any last tweaks or changes that need to be made so that everyone can give this the final thumbs up before it goes for public comment. We'll also then talk just a little bit about what's that gonna look like, what does that mean, how's that gonna play out? Who gets to totally rewrite this plan that we've written? No one. Good news. Only you. Better news. So in here, I kind of went through all of the sections, right? The executive summary and the process and the background, blah, blah, blah. What I want to cover really quickly are the two pieces. We haven't had the big in-room conversation on of the plan, which are the GARE analysis, which Cody has done some work on, and pretty much my understanding is I'll let Cody give a summary of how we got to here in just like 20 seconds. And if there are any concerns, we can chat about that. Then we're going to talk about where we're at on the process measures. I see Andrew is online. I will put him in the hot seat a little bit along with Christy on that so that we know where we're headed, so you know what you're saying yes to when you say yes to the document. And then we'll open it up for general comments. So Cody, real quick on that, and Christy, I'll hand it to you and Andrew, and then I'll bring us back for how do we get to yes.
And Cody, are you logged into Zoom?
Oh, I am not, but
And
hopefully
will you
people
come
can hear
stand
me.
where Addie is, so
Yeah.
that it's
Oh.
not just a disembodied voice
Sure.
on the internet?
I'm getting soda.
I feel like I'm on.
Job, Addie, you deserve it.
It's meant for people that are COVID.
I got you,
Okay,
my screen
great.
moves.
Oh, great. This can't read my buttons, so that's perfect.
I did not know this was that type of meeting.
Making this really awkward.
So for the GARE analysis, this is something we do for big decisions like running plan. We did the short version of the GARE, which is 3 questions as indicated in the 2-page plan. That's written out by me and reviewed by our team, and then our DEI committee reviewed it at our last meeting. There are a couple of points of feedback from that committee that haven't yet been integrated into the current version. We do that so that we're not doing version after version after version, and then people still get a chance to provide positive feedback. So if you have that, it's welcome. Keep in mind that this plan is incredibly broad, really big, and most of it hasn't really been done before by other states, and so I don't have a lot to pull from example-wise when looking at what the equity impacts are.
So when you're trying to put data behind those
Yes.
claims, right? What Cody normally does is does like a literature review where he'll find evidence that population is impacted in this way by these types of strategies. If you think about the equity review we did for House Bill 3835, like this feels like a really valuable solution for this population, but we have evidence they're actually more likely to experience harm under that strategy than not, right? So that's what he's looking for. A lot of that doesn't exist in this context, but where you can find it, you are
Yes.
documenting it, yes.
Yep, always. That's the 1 minute, 30 seconds on.
Great.
on equity.
Questions, comments, concerns? So the edits that we heard from the DEI committee, as well as any edits around our equity analysis that come in from our public comment, will all be incorporated at the end of the public comment period. It's just too messy if we just keep iterating over time. So that feedback is, that door is wide open. Send your feedback. Cody is ready to make those adjustments, but we'll do it all at one time at the end, sometime in mid-November when public comment period closes.
Hand up from Emily.
Thanks, Emily Cooper.
I loved the data piece of this. That way we actually know what we're measuring. Like, I think Cody, your work there is fabulous. My only comment is, does it make sense to also do that under the equity analysis so that we know what is our current state of disproportionality, say in terms of Black and brown kids getting services compared to the population? Like, should we bake some of that in so we also can then measure whether or not we succeed in our equity efforts?
I love that question. Oh, go ahead.
Sorry, I put my camera on for this so hopefully people can see me. That way I don't have to go stand up there again. first, all the data work isn't obviously just me. That's a lot of Christie's work and a lot of Andrew's work and our data committee. Second, we do have a lot of equity about the data. It's in the appendix. Within the strategic plan itself, those sections for the measures, it doesn't really fit to have this like full structured review of each individual measure there, but they are in the appendix if you want to look at some of the equity issues of the data. We are also limited to what the data actually include and say. And as much as I would love for everything to be perfect or like have real D, that's not what we have to work with. And so we're going to do the best we can at looking at the inequities, but we are limited to what's available.
Can I make a proposal based on what I'm hearing from Emily? I don't know if you can see me where, but I think what we can do is make sure that in our appendices and in our indicators section, we make a commitment to providing disaggregated data wherever possible. When it makes sense, when it's available to us.
Oops, sorry, I didn't mean to.
Because what I just couldn't get to the button. I think what I'm hearing, I think actually Emily and Cody in some ways are saying the same thing, but we can just add a real clarifying sentence to the plan section on our strategic indicators that says where available, we'll provide disaggregated data. Just for those, that term is just being really clear that when we have different data on different races or SOGI status, et cetera, it's provided so that you can look at them side by side. That in some ways really brings equity into the conversation every time, because you're not looking at the big number and saying, oh, I guess kids are fine. You're looking at the big number and saying, oh, it looks like kids are fine, but actually it's only some kids that are fine. So what do we need to be doing to make sure the system reflects that? And I know that's been a big part of some of the data conversations, but we can really clarify that in the strategic indicators section. I'm looking at the two data people to make sure I'm not.
I'm kind of like wondering if we're setting goals for like reducing disproportionality in certain systems of like, we see an increase in Black, Native, or Black, Indigenous, and Latino kids in community-based services and getting access to the screenings, right? They're getting their EPSBT services and then getting the referrals that make sense. That's one of our goals, right? And we're seeing a decrease in Black, Indigenous, and Latino kids ending up in child welfare or juvenile legal, particularly in the cases where they're doing that because they're not getting access to the care that they need. And so they're only, that's their door into services and supports, right? Can we like set some goals? I'm looking at you, Cody, to like track. I know SOGI and REAL-D isn't perfect, but as we're starting to see like levels even out, right? That we see reductions in that disproportionality. Can we set those goals, or are you like, we can't accurately track that?
It depends on what the measure is. A lot of them come from different sources. Oh, for the dashboard, REAL-D, yes, SOGI, no.
Gotcha.
I'm thinking if we look at pages 18 and 19, just to sort of ground in what we're talking about, and you're also saying sort of the exact same thing. So for example, on page 19, down system involvement, decrease involvement in child welfare and juvenile justice systems. If we disaggregate that data, we're going to be looking at exactly what you're talking about, which is, are we still seeing disproportionality in Black and brown kids? When we pull that data out to look at it separately. So I think in some ways it's built in if we make it really clear that wherever possible, we can that data in a disaggregated fashion.
Yes, and I will be.
Is that track?
Yep.
Yeah, to that. So, because y'all know I love data. So once we kind of, I guess, fix the disproportionality, right? Let's assuming that everything goes perfectly fine,
25,
right? Everything's gonna be,
26, we'll get us here, my bad.
everything's gonna be perfectly fine, right? And the strategic plan will work out the way that it does. And we are able to, like Anna was saying, kind of level out those, the data among Black and brown, Native kids and white kids. Is there room to put into the strategic plan kind of like a forward-looking goal where, okay, now that we've achieved this leveling out, we want to ensure that, you know, this group doesn't get disproportionately impacted again, or because there is this major focus on reducing disproportionality, now we're seeing an increase in white kids, being disproportionately impacted. Is there room to put something into that so that now that everything's level, we can actually help and support every youth in this, in the state?
Absolutely. So what I would say is, I hope that you and I are right on this and that by 2029, that has been fixed, right? I think realistically, we all have some doubts about that, but that's exactly why you have to reset your strategic plan every 4 years. So in 4 years, we'll have another data party similar to the data party that was a part of the design of this plan. And if what the data party is then showing is actually like child welfare has figured it out and is serving families in home and it's not disproportionate, then all the pieces we have in here and in here about how the mental health and child welfare system interact to create that will need to change, and a new goal will need to be struck based on whatever you're seeing then. So it's not so much, I would say, something that would change this plan. Now, I would hope, like we talked about a whole lot, that the place you start for your next plan is right here, because this lasts those 4 years, and this becomes your baseline. But that's kind of what it looks like. On some of the, what we're going to talk about a little in the second half of our adventure today is, as we start to check off some of the action steps, the smaller, more bite-sized things, a little bit less like this proportionality ends, and a little bit more of now everybody's getting collaborative problem solving. We found out how to get that happening. You check that box. This group might come back together and say, oh, what strategy is that under? We've completed all our action steps and it's only 2028. What are we ready to do now with the knowledge that we have now? Does that kind of make sense?
Yeah, makes perfect sense.
Okay. Love that.
So you said pull up page 18, so I just did that. So I don't know if there's anywhere else in the plan we want to sort of direct our attention, but these are and this is the edits that hopefully any of you who participated in data committee. This is what you did. All that blue text, it's your work from last week. Isn't it fun to see this document evolving in real time?
We were balancing out getting people our chance, copies and utilizing pre-existing subcommittees that we're meeting. So that's what you're seeing here.
Who's that on?
We are on page, kind of straddling between pages 18 and 19 on the pages at the bottom of the document that you're looking at. And you have a little bit of an older version of that.
I think this may be the old version though. So we may.
Yeah, we printed out the old version.
Oh, okay.
We wanted the same one that you reviewed to be the one that we were looking at.
Emily Cooper is in the chat requesting we add that language to the process measures on page 20.
Let's see. Oh, so disaggregating process measures in addition. I mean, that's gonna be a little trickier. Let's do this. Let's talk a little bit about what are you talking process measures, Emily, or are you talking strategic indicators? Because I'm suggesting we add strategic indicators. We can talk process measures, but I think once you get a sight at what some of the data committees come up with, it may not make sense. Just because what those indicators actually are, not what you should be doing it, but go for it.
Yeah, no, I think that makes sense. I think I didn't exactly know what the process measures were, but it makes sense that if the strategic, whatever the language was,
Indicators.
where we are, then how do we know how we're going to define our process? That makes sense.
Yeah, perfect. And I have a note, and I have a note on my document, old school handwritten, probably driving Anna bonkers, that says, add sentence about disaggregating data when possible. And so I will go in right after this and add that exact sentence.
And Christy's doing it electronically right now. Isn't this
Shown yet. All right, so let's talk though a little bit about the plan on process measures and what Andrew has come on camera to defend himself. I can see I'm just teasing. It's okay that I tease you. To talk a little bit about those dots that you're seeing on the plan that are unfilled in, because I think we're going to talk about how what we've recognized is those actually correlate much more with the implementation plan than the strategic plan. So, Christy, do you feel ready to lead us through a little bit of that conversation around the process measures?
I can if Andrew doesn't want to.
Or Andrew, take it away, friend.
Well, I do want to take a minute and make sure, because I don't want to assume that people are tracking every page of everything on every data point. And so I just want to be really clear about what we did and kind of how we got to where we are. So we've been talking back and forth about strategic measures and process measures. And so just to make sure we're all sort of on the same page, the strategic measures, I think there are 8 of them. We started like 6 months ago. We looked at lots and lots of measures as a committee. And just to the conversation you were just having, one of the evaluation points for all of them were, could they be disaggregated? Because we chose early on not to pick measures that were about, race, ethnicity, equity, but to make sure that all of the measures that we had, whenever possible, could be disaggregated, because we know that's important for all of them. So that was a key decision that we made kind of early on. Then kind of going to the strategic measures, I think that's what they're referred to. I've been calling them something else, but strategic indicators that are on, I guess, page 17, start of page 17. You're showing process measures on the screen here, but I'm just trying to make sure that people understand the strategic measures are more about, what we were trying to do is get more at the quality of life things that people care about. Are fewer people trying to take their own lives? Are fewer people having issues with substance abuse? Are there more people? This isn't so much a kind of an outcome indicator, but are more people getting specialized services that we've all been talking about for years? We're going to be monitoring that over time. Are kids feeling like they've got someone to talk to who's safe at school? All of the things that you see on those pages, those are the ones that I think are most fundamental to the work that we're doing, which is, are people's lives getting better because of this stuff? Or are we just talking about a whole bunch of processes? So I would really, as a council, I think we should be fundamentally focused on those. But there's also the point that, we do need to measure processes, because the assumption is that if we engage in the right processes, we'll get good outcomes. And that's sort of where the process measures come in. Those are...
Andrew, and get people oriented in the document, because I love how you're really separating the 2 out and giving a clear explanation. So for those who have the document in front of them electronically or otherwise that was shared, you'll see at the bottom of page 20, 2 big empty dots. You'll see that repeated again on 22, 23. Those dots are just for each of the goals. We've held space for what Andrew's going to discuss, which are, instead of being that big overarching fundamental data that is our guiding light, it's, are we making progress on this plan? Like, are we doing the things we said we wanted to do to reach these strategies and goals?
Yeah.
So that's where you can see it in the document, if that helps people wrap their heads around it.
Sorry, Andrew, I'm gonna talk a little bit too. I think this is the difference. The ones that you were just discussing it's something changing for the people we're all here to serve.
Mm-hmm.
And the ones that we're kind of going into, these process measures are like, it's the way people work changing, so that something can change going around for the people we're here to serve, right? So it's kind of logic model-y, like, if we do things differently, something should change. Are we making the right different changes in the how, so that we get the what we're pursuing together? Yeah.
Because, for example, I'll just pull a random example out. A process measure is, how many registered traditional health workers do we have? Peer and family support partners. That's a process measure. It's something that's important that we want to track. But that's not what we really are shooting for. What we're shooting for is people being healthier and able to stay in their community and not have issues, with as much of a problem with, significant mental health and substance abuse and things like that. So it's sort of a process measure as a means to an end. And I want to make sure that, we keep the ends in mind and not the processes, which, a lot of bureaucracies do. And we are in many ways a bureaucracy, whether we like it or not. But we measure processes, and that's not really what we're fundamentally, I think, here to do. So anyway, with that sort of strategic.
Sorry, Andrew. Yeah, quick question. I really like how you've cited where you're getting each of the data points, and how we are like the continuation of measuring. The home and community-based services are just numbers, and don't say where we're getting the data from. And I think it would just be a good idea to state where that data is coming from as well, so that it can go back and measure it if we're not the people who are measuring that.
Yeah, I
On
think,
page 18, I got that note.
yeah.
Okay.
Adam's looking at one of the specific process measures, and I think I'd say we're about 95% done with this work that we're talking about. Nothing from a content standpoint will change, but things like Adam just brought up, we're going to kind of finalize. But just to say it, like, for example, one of the things that we're going to be measuring as a process is that was more on the strategic indicators. Are people getting more in-home services? Are people getting a couple other things that were actually in Senate Bill 1, which is how we landed on those? Most of the things that are on that list that Adam just mentioned, where it says IIBHT, 269 kids, and behavioral health treatment foster care, 53 kids. Those are all coming from reports that are mostly produced by OHSU and their data team. They're under contract with the health authority to produce data for those things. So yes, we will unpack that a little better. Anyway, kind of going back to the process measures, we do have one or two process measures that are tied to each strategy that is in the plan. Is somebody trying to talk?
Yeah, Allison, start by the hand up.
Oh, I didn't start a talk. I didn't talk, but I don't want to interrupt if your flow, Andrew. I just had a question, and maybe I missed it, but how do we currently define respite on the system of care dashboard?
The only respite data we have is that which is paid for by Medicaid behavioral health. So of the few CCOs that are choosing to provide respite, there's a few that get that service every year.
Yeah, so we do have a data point on the dashboard, and that's what Christy just said.
And then the child welfare and IT related respite, we can get that directly from ODHS.
Yeah, so just because I think we'll need to define that for IDD, because we don't call it that in the IDD space.
Yeah.
And so I think being really clear, what does respite mean? Because I think a lot of people in the IDD space, both youth, they get what we call like personal support or attendance support, those kinds of things, which isn't necessarily always respite, right? And so it's like defining what we mean by respite, I think, is really important, so that it doesn't look, because I could potentially see saying, wow, there's thousands and thousands of hours in the IDD system of respite support, but that could just actually be like actual personal care. Family might still actually be in the home, and it is respite for them, but it's also because of the high needs of the individual. So just being really clear what we mean by respite, so we're comparing apples to apples.
Yeah, that's a good call out. Thank you. There's probably, several of those kind of clarifying points and questions and stuff. And I'm happy to field as many of them here as possible. And we might have to process some of them outside of this meeting. As I was mentioning, I feel like we're largely there. I think we've got the right structure. I think we've got a really good jumping off point on all the data points and the data sources and all the things like that. But I think, like what Allison just brought up, I wouldn't have thought of that. So it's really important that we kind of clarify, because what respite means in behavioral health or child welfare might be different than what Developmental Disabilities thinks of it. So I'm hoping that Christy's taking notes because I can't take notes and talk at the same time. I can do one thing. And usually I try to do it good, but I can only do one thing.
I got you, Andrew.
Chrissy's taking notes, and these ones, are iterative, we can change, right, as the plan grows and changes to the point that was made in response to Alicia's comment earlier, like, these measures aren't working for us, like, those global indicators we're trying to stick with, those are not changing. All of the things about process, if they're not serving us, this is a living implementation plan, so we're gonna change how we're implementing if the strategies we're trying are not getting us the results that we're looking for. Those measures can change too, if we're like, oh, that's not really pointing at the thing we wanna be looking at, it's pointing over there, then let's find the thing that's pointing where we wanna be looking. We have that freedom. We made this plan, guys, we can change it anytime we want.
We're keeping the data committee busy. I heard they were bored, so.
Oh yeah, and if as you dig through it, you're like, oh, I have a subject matter expertise in a field that maybe the folks in the data committee didn't have. That is a great email to send to Andrew and say, respite looks different for IDD. Here's what I would recommend, right? Andrew can be your point person or Christy can be your point person. You can't go to the whole council because of public meeting law, but you can email a committee chair, you can email staff and just say, here's my feedback. Sorry, I take up space.
No, this is an important conversation because we're really trying to figure out how do we evaluate, how are we going to watch the needle move or not move? And if we don't really understand and buy into this model, then we've got a kind of a problem around that. We can do stuff all day long, 12 hours a day and 365 days a year, and we won't even know if the needle's moving. So we should be all really clear on this. We won't be able to tweak it forever. At some point, we've got to land somewhere and then start monitoring and then refine maybe annually or something. But anyway, that was my goal, was to really kind of make sure everybody understood the structure of how we put this together. So if there are if we want to go through specific process measures, we can. It'll probably take the whole rest of the meeting. But
one other
to where we want to go.
Andrew, I just have one other question about like the data sources. Do we know if these are data sources that are regularly updated and that are going to be available ongoing, that we're not going to have to find an evaluator to be able to do this stuff?
Yeah,
I can answer
no, that
one.
was, go ahead.
Every data source that we've listed is updated at the latest, I think, annually. Cool. Some of them do lag, but that's any data source that we look at, and they do that for accuracy. But we didn't include any source that's like, we update this every 5 years, because we'd never be able to see anything. So that was a consideration. Great.
That was one of the major evaluation measure of the measures, along with could it be disaggregated, is it updated frequently? I will say that in the process, though, of coming up with all of these things, some points were made that we had to kind of keep soldiering on. Like, for example, the emergency department boarding measure that's in our strategic indicators. Everybody felt like that was an important thing to monitor, but we know that the way that gets evaluated might be changing over the next year. And so we're just going to have to course correct if and when that happens. It's not all sort of completely locked in and will always be as it is today.
Robin has a hand up.
And that kind of goes to two questions, related and not related. When you're looking at your data from your data sources, if you're gathering 2023 data, and I saw this come out in the report this morning, that, there was a big splash and, oh, look, this great report about unmet student mental health needs. Well, it's from 2022. And we know that there were urgent unmet student mental health needs in 2022, because we just came out of COVID. It's 2025. That data is kind of like lagging for a whole lot of reasons. So are we choosing a year, and that's where all our data is all our data 2023, or God forbid, I know it's not 2024, and when we don't have a data source from that same common year, making an indicator note, because especially I think coming out of something like COVID, if we're comparing 2023 data with 2021 data, we have a problem. Yeah, that's my first question.
Two responses.
Yes.
One, Not all the data for every system is going to be collected in the same time period. They have different data lags. So it will look different, but that's stuff that I will always write about and say what year it comes from. I'm never going to put anything in writing that doesn't have a year or a time period collected, I promise.
Or like those kinds of caveats, right?
Yeah.
Like if we're looking back at 23, there's this reason to believe it's
Which then goes to the sub question of what's your cutoff year?
Yeah, that's the big question.
Well,
And
we have our baseline.
yeah, we have a baseline, and in that one, the unmet mental health care need, the baseline was from 2024. So basically, what I think I know we were intending to do, and I think we've done looking through all of them, is get the most recent data available.
Well, the report that just got released this morning on that from OHA, report highlights student mental health, unmet mental health needs, talks about, and it was just released today, healthcare needs in 2022.
Yeah, we're looking at the student health survey. So I'm seeing that what Christy.
It's the student health survey.
Yeah, I'm just noting that there's 2024 data here. I don't know if Christy can speak more specifically to that. She knows a lot about this.
I don't know why the report was looking at 2022. My only thought is that they were doing a more in-depth analysis what they can want to do with the 22 data. Maybe they started that analysis 2 years ago. Maybe it takes forever to get these reports together. So
well, the report itself,
we have SHS, student health survey data to 2024. And so that's the baseline that we're setting.
right, it's just you get where my concern comes in.
Yeah,
here.
the goal, I think the goal we all agree to is we want to have for a baseline, right? So we're setting the baseline today-ish as perfectly as we can, which is not going to be great, but we want the most recent that we have available, which the next time we look at the comparative data, we'll pull the next most recent available, and we'll have to have this exact conversation, which is like, all right, so we're getting data from 2024 now, and it's 2027. Can that tell us whether we've had an impact or not? Maybe not, because we haven't been doing the work, but what are we seeing the system doing anyway? Right, it's gonna be.
And that's like the work that will happen in the data committee. So if you want to nerd out on all of this stuff, I'm looking at a number of you. Data committee is gonna continue to chew on this over time. Like, what do those numbers mean? Does it mean something or does it not mean something? And you'll have Cody as your guide and Andrew as your guide for some of that, right? So that's really the dig into this. What does it actually mean?
Well, yeah, which then goes to the second part of the question of, does all the data come from OHA or are there other data sources? When you are looking at things like emergency department boarding for children, the data that comes from OHA is not the data that I think hospitals would tell you is the reality.
So I think that's exactly earlier when Anna was like, oh, if you know that the definition of respite is different for this, let Cody know,
The
hey.
definition for boarding from hospitals' perspective is very different than the definition that you get in an OHA report. And that's something like where a hospital association could be a very useful partner to tell you, because they're pulling that data by DRG code. They're pulling that data by what is actually the definition of boarding, which is when you've made the decision of where someone needs to be placed.
But they can't go there.
That is when they're boarding. If it takes 24 hours to figure out where someone needs to go, they're still actually being treated in the emergency department. So 24 hours is not a metric. The metric is when we've made a decision for disposition and then there's not an ability to move someone. That's boarding.
So I just want to point out, there's a link to the draft strategic plan that we're talking about. If you're newer to the Zoom room, scroll up. It's from Corinna Hazard at 1:04 p.m. if you want to see what we're actually talking about. And then part of the reason, Robin, why we have so many different measures that we're looking at is, again, to just like, okay, none of these are perfect, right? There is no way you can take a human's experience and turn it into a number and have it perfectly reflect their lived reality. But if we're looking at 30 measures over time and they're moving in the direction we want them to move, that's an indicator that like maybe we're doing something right? If they're not moving at all, maybe nothing we're doing is having any impact. Maybe we're looking at the wrong thing, right? But that is part of why we sort of spread. We've got some national measures, we've got some state measures, we've got measures that ODE gathers, we've got measures that OHA gathers, right? So that ideally we're starting to see progress in the same direction.
But to be
from a lot of those measures.
One of the reasons you're seeing two sets of measures, one is the strategic indicators and the other is the process measures, is I wanted this group to see some of the success of the work that you're doing. And with the imperfect data that we have and the complexities of the system, We may not see the needle move on some of these strategic indicators in 4 years. You all know that, you've been doing this a long time. But what we can see move is, did the number of youth accessing respite care go up, right? Like we can be like, okay, we didn't magically fix the fact that like kids aren't getting the healthcare they need in their communities every time. But we did in fact tackle one of those problems we said we were gonna tackle that in the long run should have an effect. So the big picture strategic indicators are what's the health of the system in general, right? How's it doing? Are we having an impact? But because the work we're doing still matters, I wanted to have a set of measures that allows you to see the difference you as SOPAC are making on some of these points. So there's 2 sets for that exact reason. And if I'm being really candid and in spite of being recorded, you also then can go to the legislature and say, we're sorry we didn't fix children's mental health in 2 years, but look at these great results we do have from our process measures, right? Because there's a lot of pressure on this group from outside entities to magically fix things that are really complicated and to have the data to prove it. So I wanted us, the data team, to be thinking about 2 different sets of data so that you can say, wait a minute, we're still doing really good stuff. And we can't tell yet whether because the data is bad or because it's such a big system if we've moved the big dial, but we've moved a lot of little dials that made a lot of differences for a lot of individual families in this state in the last 4 years. So that's part of why we've got these 2 buckets for that exact reason. And
Okay,
all just got to relive some of our most intense small team moments around data. So welcome.
So, okay. Right? So strategic indicators, right, is what we have right here.
And those are pages 18 and 19. They're not what's on your screen.
Thank you.
18 and 19. Yeah. The process measures are those ones that you have the open dots stored like out the plan.
Okay. So with the, and this I think goes to what I was actually I was going to ask earlier about. So the strategic indicators, I'm seeing a lot of youth focused indicators. Pretty much, I think each and every one of these indicators, I think, is youth focused. So I'm wondering where, I'm wondering where families or family members or families play into this. I understand that there are a couple of them in here where, like, in a roundabout way, indirectly, family members are also taken into consideration in this. However, if you don't have a healthy family unit, it's going to be very difficult to actually then support youth, children and youth within that family unit. And then we're seeing these numbers, right, that we're struggling with right now. So my question number 1 is, like, where are the family or family member, parent, guardian, any of those things, indicators or strategic indicators here, because I don't see them. 1 and 2. So I guess my next question would be for the process measures, right? The process measures, when we're talking about, like, Robin was indicating that there is a difference in the way that boarding is defined, right? Or who would look at boarding in which way. The data committee over the next couple of months can then actually look at, even though we've already done some of that work, is there still room and time to identify additional areas or additional data collection that we can utilize for the process measures?
Yes. So I think, just as we've been saying, the data collection and processing, especially for the process measures, is going to be very iterative. It's going to change as data is or is not available. I also think to tackle the second part of your question, and then we'll circle back to the first, use very official facilitator language. Christy, do you want to, and Andrew, do you want to walk through these slides that have the process measures you all are suggesting? Because I think you're going to see a lot of families on these slides in the process measures, and then that'll give us context to revisit the conversation about the strategic indicators. Yep.
Yeah, and I mean, I wasn't like, I see on here, I see family members and I see families, right? But when I'm thinking of strategic indicators, right? That's kind of like that big picture thing where like, system partners are going to look at the strategic indicators. They're not going to necessarily take the additional time because there's a lot of things happening. They're not necessarily going to take the additional time to actually look at the process measures. So their focus is really going to be on the strategic indicators. So if they don't see families or family members or parents, guardians, any of those things reflected in the strategic indicators, then I don't think they're really going to give 2 cents about what the process measures actually say. Whether that is, intentional or if there's just a lot of work happening and everybody's exhausted, right? Yes, that happens. But that's where I think one of my biggest concerns is that families as a whole are going to be forgotten in a way when it comes to the strategic indicators rather than process measures.
Yeah. There's a couple of
Question,
I see your hand.
a clarification question. What would be an example in your mind of a family strategic indicator? Because I'm trying really hard to think of that. Because I'm looking at some of these strategic indicators and we're trying to family it. I'm like, I'm not getting there, help me out.
I'm going to jump in there actually before the end of that. The way that I'm seeing it, right, is that we want to see, just from quickly skimming over all the strategic indicators on 18 to 19, as the only youth in this room, the way that I see it is like we want to see the dial move with the youth, like with their families as well. But I feel like the focus is on youth. Looking at this as a youth who is excited about the strategic plan and wants things to move forward, this all looked good to me. But I agree with you, Robin. Like, what, instead of saying this isn't good enough or we need to change it or families feel left behind, what is something we can actually add to it so it's not just this is bad? Okay.
I'm sorry, I didn't mean to.
No.
Question can go to the group, which is right. The goal, the foundation of what it is to be SOPAC is to improve the children's mental health system. And what we're seeing are strategic indicators that show us in different ways kids' mental health is getting better, right? Whether it be school, the ER use, decreased use of systems kids shouldn't be in. So I think the question becomes, what's a strategic indicator that we have measured about family that shows us children's mental health is improving or not improving, right? Because I think that goes to both of, like, all three of what you're saying in different ways is how do we make sure that families are not forgotten, but in this instance are remembered in the fact that they're the unit supporting children's mental health. So I'm not as familiar with what.
Some of our youth did not have that privilege.
Right, of course.
Yeah.
Good
So
point. Thank you for that.
There was a family measure as a candidate for the key indicators. Remember in the data committee, we started with like 16 and then we had people kind of dwindle down from there. One of the potential key indicators just didn't get ranked high in the survey and we just made a decision that we're not going to do all of these things. We'll take the top 8. That measure that I'm thinking of is now sitting as a process measure in goal 3.
Let me go.
So I wonder if, back to Addie's idea, if we just kind of pivot to a second to look at the process measures and then we can.
Can I say something? Please do.
I want to, because I know that everybody has lots to say, and I thought you were getting ready to say something, so I want to make sure that you got opportunity to respond and say anything that you want to bring forward.
No, I appreciate that. I was just going to say that I had never said that I don't like this plan at all. Like, that's not even what I'm trying to say.
No one's, I don't
I'm
think,
just saying that.
I don't think anyone's saying that they're saying that they think you think it's bad. What I'm saying is that that was the quickest and easiest way that I could say my point. So that's what I said.
Okay.
I'm saying more so like, hey, if you want me to be like specifics about it, like I'm looking at this and I'm not seeing things that show me as a family member that thought and care was put into place to have strategic indicators saying that the family is healthy, not just the youth. If you want me to get into the specifics of it, that's what I am hearing that you're saying, that you don't see that in there. I just want to make that clear.
Yeah.
I don't want to put words in your mouth that you're like, no, like that's not what I'm getting.
Yeah, and I think that's really what I was going at with this, is that I just, even if it's just one indicator on here, that suggests that it's actually like,
Sorry, Robin.
it's a very specific like family unit, because I mean, I understand that there are youth who don't have the privilege of having a healthy family, right? And the goal is really to try to ensure that every youth has a healthy family, whatever that family looks like. It doesn't, like, family to me doesn't necessarily need to be, biological parents of the child, right? It could be a healthy foster care placement, right? That could be a family unit, really. Or it could be anything other than, just biological parents.
And it could be grandparents or whatever.
Right. And that is what I am not seeing necessarily in these strategic indicators. And I was wondering if there is a way to include just one type of indicator. And that could be a conversation that we can potentially bring to the committee if necessary, or we can just all come together right here and look through the process measures like Christy was suggesting, and then.
Yeah, so I think the one that Christy was mentioning was the one percentage of families reporting a well-functioning system of care. And we tried to dig into that in our data committee conversation, and the link was broken. So we couldn't see the Oregon specific data. We just saw the national level data, and we were like, this is meaningless for us. But it turns out that there is Oregon specific data with that indicator, and it looks real bad. So percentage of families currently indicating that they are experiencing as a family unit a well-functioning system of care is like 16%?
20%, I think.
Okay. Right, so we're like, that's one of those things where like it was proposed in that like overall indicators, it didn't make it in, but we're like, we still feel like there's real value here. So let's put it in our process measures while we're looking at how are we better using families as supports and partnering with families as leaders in the system where that's appropriate. Are families feeling it in these local measures and these national measures? Are they saying, yeah, it feels like I was a partner, it felt like the system worked, right? So there's some Oregon OHA, OHP data survey that they send out. I will tell you that like in my household, those surveys go straight in the garbage can, recycling bin. Sorry, Abby.
No, I was reminded, I'm
trying to get my kids to respond to them and they don't.
Survey or anything. I gotta do better too.
Together to lean in on the surveys and recommend them. And I think you have something to jump in with.
I just wanted to say, and I'm on page 18 as someone who works with families on a daily basis. These are the measures that I feel like family is embedded in here. Because all of these things listed, SUD prevalence, unmet mental health, home and community-based services, those are all things that families, along with the youth, are asking for. So for me, it feels like this is family. Although it says it's not, it doesn't specify family, but it is what families are asking for and need to be a whole family unit. Yes, family may need different things to different people. I understand that. And I also understand that families are crying out for help in juvenile court for these services. So for me, it feels like families embedded here.
Thanks for that. And that's kind of where we were coming from, I think, with these measures that was embedded. And I think, Alicia, you had even mentioned in the beginning that, in a roundabout way, it's sort of there, but I feel like it's embedded as well. That's my own personal belief. But we can,
I think I want to clear. Oh, I'm sorry, Andrew. I didn't realize that you were still, I didn't mean to interrupt Andrew.
That's okay. Go ahead.
Our meetings are super hard. Everybody's hanging there. So
I want to be clear that I am very well aware that these do have like the family unit embedded within it. And I think here in this room and online, we very much understand this. Mm-hmm. But what I am concerned about is other systems who are not necessarily constantly kind of doing the work that we do and are constantly embedded in this work aren't necessarily going to see it that way. That was just my biggest concern in terms of this. And I would be totally happy if we could have that, the percentages of
Families reporting.
Yeah, families reporting, right?
Oh, sorry.
Yeah, families reporting a well-functioning system of care to add to the strategic indicators rather than in the process, because it's kind of that, the higher level or higher level indicator, I guess, best word, for families, right? For the strategic plan, I guess.
Cody, did you want to jump in?
Alicia, I hear what you're saying. I do kind of disagree. I think this is a better measure of a process than it is anything else, because it's opinion, it's an opinion, it's reporting a well-functioning system of care, but it's not like, it's not as much of an actual outcome as a lot of the other ones that we have as our strategic indicators. I think these process measures are all really important, and so I don't view them as like a back burner or anything like that. I think these are incredibly important, and they show that the work is still being done.
I think to your point, Alicia, it also matters how we do the work, right? We're reviewing as we move into our sort of new structure, right? We're reviewing these process measures and saying like, hey, this isn't changing, right? Families aren't feeling anything on the ground. Like we can choose to elevate them for our agency partners in terms of like how we do what we do moving forward. Do you know what I mean? Like I heard you say like, if they're not on the front page, nobody's gonna pay attention. I think that's our job. We make them pay attention.
This year.
And I see a comment in the chat when we don't hear that. Okay.
I have something that I want to say that I feel like I wanted to say for a bit, and I don't want anyone to get mad at me. If they do, it's okay. We're in person. We can square it right now. Dance battle right in the middle. Let's go, baby. Vault over the tables. Anyway, before I lose my train of thought, if the goal is to, if not fix, alleviate the negatives around youth mental health, houselessness, familial bonds, all that sort of stuff, I would much rather hear from the youth than the family units they are in. And what I mean by that, as someone who's lived it, is that the youth could be dealing with a whole load of issues. What we saw when me and Jesus were reading through the big old data thing was that a large portion of youth that are taken away from whatever their homes and receive the services that they need, when they get better, they go back into that environment and go back to where they were before they left. It is statistically proven from the data we collected, or however we got that data, that it's very important to focus on the youth's perspective versus that of a parent or guardian. And I feel like this better reflects not only a youth-focused lens for a problem that we're fixing in the youth, but it still also allows for there to be markers around the homes that they live in. Like 86% of students reporting having a safe place or person they can go to outside of school hours. If that gets higher, that means they have people at home they can talk to, which that's just one of the indicators that I see that I'm like, that's a good thing. As someone who could not talk to anyone in my family and is estranged from everyone currently, like that's really important for me to see. Or like baseline 33.9% of youth aged 18 to 25 report substance use that met the criteria for substance use disorder in the past year. If that goes down, that also most likely means that their family situation is now a healthier environment for them to be in and to get the help that they need and to continue that health journey versus going back into the same situation that they were in when they got took out. The same data I just talked about. I don't know again. Like that's how I feel. And it's a feeling that I've had since before we started working on the strategic plan. And now we're here and I'm saying it because I can. So yeah, that's it. That's my little thing.
I'm gonna call on Adam. I'm gonna read out what Selby wrote, and then I think we're gonna say further discussion is welcome in the data committee space so that we can keep moving.
I figured out to where I was gonna add, so.
Oh,
Thanks, Beer. So Selby's talking about the comprehensive community mental health services grant and the evaluations that they do with that grant program that shows systems of care which are successfully improving outcomes for youth are also correspondingly showing improved outcomes for families. Specifically, caregiver ability to handle their child's challenging behaviors, family problem solving, caregivers having the increased ability to attend work and decrease caregiver strain. So I think her point is really just those same that, like, if we're talking about families or systems, when we are improving a challenging portion of the system, we're improving the system as a whole. We may not be primarily focused on that because our mandate is youth and youth behavioral health services, but we're impacting the system as we make those positive changes.
Equally as important, Jesus is agreeing with me that Christy sends too much reading, so. Take that away that's in the chat.
He also reads everything. We'll be in meetings together. Like, why is there 3,000 pages? It's very fun.
Is there anything else you wanted to say on the data, or do you want to like dig in on these process measures? We didn't really get into any of the process stuff. I'm just mindful of time.
Were you talking to me just now?
Yeah.
There's a whole conversation happening there. I don't really. I want to make sure we make productive use of people's time, and it's clear that we have a little bit more refining to do here. We're not going to continue to reinvent this month after month after month, but it's fair to say we've got some refining to do here. So if you look through it, from my perspective, we don't need to go through every last thing. But if you look through it in your leisure time and you just can't live with something, or you have a really good idea about what should be added, raise your hand, come to the data committee, do your thing, because we want people to feel good about this, even though we can't let, perfection be the enemy. So that concludes my report.
Great.
Nice job, data team.
Right, heavy lift to keep us on track and make sure we're going over time. So I was gonna say, I think what we should do is take a break and come back in time for public comment. After that, what we'll do is walk through any suggested changes to the strategic plan and then pivot to our activity. Yes, please.
I have to step into a crisis stabilization meeting, but I'll be back as soon as I can.
Gotcha.
Okay.
Your thing.
To be flexible. We'll see you all back here at 2:30, and there are snacks and bevies, and I can attest to them being delicious since it was my lunch here Cheetos today.
I'm coming for the Cheetos. I'm going to come busting in there like the Kool-Aid man, getting my Cheetos.
I feel like we need like a more significant event since it's always.
They're always good though.
They are always.
It goes, it's always fun.
Thank you, Robot.
We are being recorded. I don't know which one of our illustrious co-chairs has the public meeting announcement or public comment announcement. Agenda today.
This is public comment time. This is Annette. We're open for anyone with public comment, so raise your hand. And I see someone with the hand up. Selby?
Yeah. Hello, good afternoon. My name's Selby Stebbins, and I'm the System of Care Specialist based at Health Share of Oregon in Portland. And what I do is I try to strategically support our Tri-County System of Care Collaborative for Multnomah, Washington, and Clackamas County. And I just had two, one question and one advocacy point. In light of the previous data discussion, I just was also going to request that the data committee consider or investigate the option of how early childhood fits into the strategic plan. I certainly understand that ages 0 to 5 are, again, yes, implicated and embedded in all of the implementation steps and different indicators, but I also think that early childhood range of 0 to 5 is a key way that we can look at our upstream measures. And so I just had some curiosity if it would be worthwhile to have some kind of indicator that specifically called out improvements for the age 0 to 5. I was thinking, you know, I appreciated the comment made earlier that the indicators really need to show how we're improving children's mental health, but I was thinking things around, you know, preschool and kindergarten expulsion rates or disciplinary rates, you know, things that a lot of times kind of behavior problems in the classrooms are actually symptomatic maybe of a mental health or behavioral health concern for young children that young. So anyway, just wanted to put that out there as a potential area for curiosity, either in the strategic indicators or somewhere in this plan. The second thing is I noticed that some of the process indicators, they cite as their data source the System of Care Infrastructure Survey. And if it's what I'm thinking of, I believe that's an assessment that we'll be asked to do with our local systems of care. Some of us also participated in the SRSI assessment from 2 years ago, and SRSI is System Reform Support Instrument. But I'm just thinking if that's something that you're going to be using as in your process measures, I'm just requesting on behalf of myself and hopefully maybe all of our local systems of care to really help us with the technical assistance or best way to implement that so that the data you're getting is meaningful. Just because I can remember when I tried the previous assessment a few years ago, it's really complicated to take people across multiple different systems and yet pose a question to them of, well, how is our one children's system of care functioning? And so, yes, that's all. It's just please provide us assistance and support if we're going to be implementing that system of care assessment survey so that the information you're getting that you want for your process measures is really useful. Thank you.
Super helpful. Thanks so much, Selby. Appreciate both your comments.
Yeah, thanks, Selby. I will definitely I can follow up with you offline and also the other coordinators about the System of Care Infrastructure Survey. So thanks for bringing that up.
Thank you. Thank you, Selby. Public comment, anyone else? I can't see hands raised necessarily. Anyone else have a comment? This is your time.
Yes, I'm being here to support you if you want to text or message, or you can just raise your little Zoom hand, or you can just say it out loud into the world.
Say it loud, say it proud.
All right, man.
Seeing no hands, Jolene, did anyone reach out? Alicia,
No
anyone
private
reach out?
messages.
Okay. I don't have any messages. Okay. All right, we'll turn it back over to Adam.
All right. Really, I'm just handing it back to Adam. Yeah.
String that you throw.
Zip zap zap.
Not zip zap zop.
Neither do
No.
we get that. All right, so we have reached the point in today's programming where I'm opening the floor up for any sort of necessary changes or suggestions on the Word document so that we feel comfortable after today's meeting sending it out for public comment. So if there's anything in here that you want the group to consider, now's the time. We've made a couple notes already about how we want to be sure to have citations for each of the indicators so that it's very clear, the year for each of the indicators so it's very clear, how we want to make it clear that as we present indicators, we will be disaggregating the data. So those suggestions will be, that we discussed this morning, that everyone sort of was on board with this morning, in the first half of our afternoon meeting, will be integrated. But if there are other, there was also a comment from Emily Cooper about making sure that our indicator with regard to, let me see if I can get it right here now that I acted like I knew what I was saying and I got ahead of myself and I should have had it in front of me, making sure that our community and family placement indicator was community and family, because all of the data under it was bigger than just within the family. So Emily, we saw that in the chat. We've also made a note about making that change. So aside from what I just pointed out, which are the changes we've made note of from this morning, anything else people want to discuss that was in here that they'd like to see changed, adjusted? I don't want to say fixed, but we could say it.
So then what we're doing with this will be the version that we send out via a public survey that folks can forward to people. It's going to be the version that we send back to those community-based partners that generated priority population feedback. Right, so this will be the version we send out to the world to say, okay, if you helped us generate this plan, did we hear you right? Is this what you thought you told us? Are we going in the right direction? So it's not the final plan, right? But it is this is the public's first view of this, and it will set a frame and set a tone. So if there's something in there that is harmful language for the community that you represent, if it is off-putting, if it is really out of alignment with the way that people talk about things in your world, those are the kinds of things that we need to hear about now, because we're trying to avoid hurting people as we try to fix the system to the extent that we can.
I just had a couple of other things that weren't in Addie's notes.
Great.
And I'm happy to
give me page numbers. That will be just as a general rule for this portion so we can all follow along. That would be super helpful. Unless it's a global comment, and then we'll just magically have it.
Well, some of it's not. One of it's the process measure about respite. I do think we could define respite more clearly.
Okay.
How if we are going to use a dashboard, just what's the definition in the dashboard? We just need to unpack that. The other was the data sources on the specialized community services. I guess in the document it lists numbers, but it doesn't list the source of those numbers. So we need to kind of identify the data sources for and also in the document, it still calls it home and community-based services, but we changed that more recently.
Yeah, that edit just didn't get made on this document, Andrew, but it is in the version that we'll send out.
Okay, and just for everybody's knowledge, home and community-based services is like a term of art in Medicaid and maybe some other worlds, and so we didn't want to confuse people. So I think those were the others that were straggling.
Great. I think we've captured all of those suggestions. Others in the room or online, you can raise your hand, you can jump out. You can certainly send a message to others to speak out for you.
I would love to see something in this plan in regards to independent living for youth. I feel like some of these, especially when it comes to youth coming out of incarceration or being involved with child welfare, I think teaching skills to navigate this life on your own is very important. Because some kids in those systems, when they come out, they're not necessarily going to transition to a family or family member or guardian. They're transitioning out with no skills. And so those people either end up recidivating because they don't have the necessary skills, or just, becoming homeless, becoming out on the streets, and that's not a safe place to be. So I wish there was something in here that addressed those youth so that they have the skills that they need when they're transitioning out of systems.
Could I add on to that? I think it also, oh my God, covers like youth who've aged out of foster care as well. They also tend to come out of that without the skills needed to be able to like stand on their own 2 feet. Yeah, I just brute forced it. It worked out kind of.
Yeah. The places we can add that is gonna be in the implementation plan, because that's an action step type item to me, right? Really making sure we have an action step related to our youth who are aging out. So I'm thinking, I'm trying to find the best place on the spot, but I will commit to you, Annette, to taking a look at the implementation plan. And this afternoon, when we dig into it, if you see the right space for that, let's make sure that we're getting an action item in there that's working on improved access to youth who are aging out. Does that feel good? Yes.
Yeah, thank you.
And I'll have people helping me remember that.
Yep, I wrote it
This
down.
afternoon, so that we get that into our implementation plan. Great thinking. Other thoughts about what you can't live without in terms of moving this forward to our next phases? You can direct me to a page in here that you want to see a change, anything like that? Yeah, Andrew. Or are you just still highlighted because we highlighted
I think he's
you?
just still spotlighted.
Gotcha.
We love Andrew.
I have a question that isn't related necessarily to the plan, but to the plan for where we send this out to. I know that it's been probably a year since we've had anybody from community mental health at this table.
Yeah.
I assume that we do get this plan to them.
So if people are ready, we can have Christy share just a little bit about what the distribution for content is.
Yeah, because that's probably the biggest, when I look at the voice that's not in this, it is that voice of the community mental health programs. That is also, however, their own choice. I mean, they've had the opportunity to put somebody at this table for a year.
Yes.
Well, and maybe just to address that directly, I do believe we have a new person representing community mental health starting in January, but I don't see why we couldn't share this plan with them now.
Anna, can we share this or not?
Share what?
About our community mental health rep?
They're not, I
Not,
don't think we can.
okay,
Okay.
We can't be putting words in the governor's mouth.
okay.
Understood, and appreciate that, I mean, because that literally is the voice that I'm not seeing in this document. And I'll let it for the commentary.
Yeah, and so I think in addition to people we know who are interested in this plan, we can send them this document. I think we also have Association of Community Mental Health Programs, so we can send it to Cheryl for first.
Now Cheryl, if you would share it.
And as well as Ebony, like we will make sure it gets out to those people, whether or not they take the time to review. We will also share it with our local system of care coordinators. Many of them have engaged community mental health.
Maybe they can send it to their local friends at the regional level. But you're right, Robin, it remains a gap, and that's because we don't have that person sitting in the seat yet.
Can we send it to community mental health folks that we know?
Yes.
Oh, perfect.
Please,
So,
why don't we just really quick, Christy, do an overview, and then we can make sure we've covered all of our bases in terms of who will be receiving it. So why don't you jump in and talk a little bit about it, and then I'll talk about, once we've talked about how we're getting feedback, I'm gonna jump in and talk about what do we do with that feedback, if that's okay.
Great, okay. So this week, hopefully by Friday, we are officially going to start our community public feedback process on this plan. We'll have it open for 3 weeks. Why are we doing this? Well, it's good practice, particularly as a public body, but we're also hoping to ensure that the ideas that we've captured, particularly those that came from youth and family, have been articulated and captured accurately. We want to validate the overall direction of the plan. So we are not looking for lots of, spelling and language, wordsmithing, that kind of thing, but like generally broad brush goals, strategies. Do people generally think this is the right plan? Preliminary feedback tells us that we're getting some thumbs up on that. So I think we're not going to hear anything really drastic, but it's good that we're asking the question. And then we're also to kind of get some general sense for like of these strategies that we put out, like what are the things that people are most excited about? What are the places that we should start with? What do people prioritize? How we're gonna do this, we have a survey that we put together with our brand new fancy Qualtrics software that is ready to go. We're also going to be opening up our emails for feedback. Gonna give my phone number out if anybody wants to send me videos or chats, whatever, really trying to make it as accessible as possible. We're also gonna be hosting a virtual feedback party. This is really for everybody, anybody. This is scheduled for November 12th. From 3:30 to 5. Hopefully you could all come and attend and help spread the word. We'll be sharing out information about that party and registration links later this week. And then we also, we can hold some extended public comment period during the SOPAC meetings. We honestly don't really get a whole lot of attendance or people taking us up on that opportunity, but I think that'll be another place we'll really push people like, hey, if you really want to come talk to us, please do. Here's the time in the meeting. So in terms of the Robin, the core group has reviewed this plan and provided some input, but generally, right, we're going to send emails and this opportunity out to everybody who attended the retreat, to folks on our committees who are not appointed members. We're going to make sure they get the email. I'll run with some care partners, family members. We're going to try to get some engagement with the tribes. CCOs will be presenting at the CCO Oregon Behavioral Health meeting on Monday. I think Ebony's trying to get us time at the OHA's behavioral health meeting. Providers that have been suggested, you all will send it to your friends, and we'll also send it out on the System of Care listserv for the 1,500 people or so that have subscribed to that.
And then a bunch of people have just asked me over the past few months, like, can I get on that list? So I will add, like, what is her name? She used to be a member. She was Home Plate, not Home Plate. Oh my God.
New Avenues.
Yeah, New Avenues for You.
Aww.
Tabitha's on that list, right? Like, those who are interested and engaged, who have perspective.
I love New Avenues for
I have a
You.
little list at my desk.
And then we've also reached back out to the 5 community-based organizations that we provided a mini grant to earlier this year to engage youth and family. All of them, including Eastern Oregon, which isn't on the list here because I hadn't yet heard back from Chris, but just heard from her about an hour ago. So all of them are wanting to amend for another $10,000 to do similar types of engagement on the plan. So they'll be leading some efforts, and we'll get some feedback from them as well. And all of this, we're hoping will wrap up November 14th. So there's
it will wrap up November 14th.
Yeah.
Close the survey.
I just have to hit one button and it's wrapped up.
You're waiting for that.
So and then staff will go into a frenzied panic, led by Addie, who is not staff, but feels like it at this point. We've been spending that much time together.
I was really hoping you were going to say who was going to stay calm, cool, and collected.
Who is going to be calm, cool, and collected while the rest of us are panicking about getting everything in that comes in through that public feedback process, right? So we're going to take what we learned from our CBO partners and take what we learned from our community feedback, and we have some parties, or at least one party, right, similar to the data party that we had, where folks can just kind of sit with it and process through it, and there's so many different ways to give feedback. So we'll get all of that into this. We are not asking for a whole lot of feedback on the implementation plan. We are asking people in the community for feedback on this. The implementation plan is not ours, like it's how we're gonna do what's in here. So
Our baby.
This is where we're looking for feedback from the community.
So what we'll do, just to be crystal clear, is we'll receive all this feedback, and to the extent that we get specific requested changes, adjustments, or modifications or concerns to the document, we'll work on creating a chart of what those suggestions are. So for anyone who's participated in rulemaking, this will probably sound really familiar to you, but to the extent that it's not like, this was so great, rock on, or like, this was trash, burn it, right? Those we can't do anything with. I'll bring back to you a general percentage, like 3% of people said they hated it, 97% of people said it was the bee's knees, right? We'll have that number for you all to consider, because of course, if for some reason those numbers are flip-flopped, we may pause and assess what we want to do with that. But assuming it's sort of majority positive, like you're on the right track, you're getting there, We'll bring you those general numbers and then I will bring to the table a chart, and depending on how much specific feedback we get, the core strategic planning team might do a first pass at this chart so that we're using folks' time at this table wisely. But it will be, here are the 27 suggestions that we received. It was 27. The core team will say 20 of those were, we don't think we need to take seriously, either because they're not within the scope of SOCAC, or they're not within what we see as our charge, or that's sort of a silly recommendation. We're not going to buy every high schooler a laptop. Like, love the idea, but we're not going to pay that. I know it'd be super fun. But then if there are 7, like, again, making these numbers that require consideration, we'll bring to this table those 7, and I will share, just like we did today, page 9, line 8. Someone has, a number of people have suggested that we use this language instead of that language. Can we all agree that we are going to make the change, or do we all agree that we want to hold to the language that we've written? And then collectively, we will make those decisions. Anytime we decide yes or no, we will take down a 1 or 2 sentence reason for it. We really appreciated it. There was an oversight that we as a committee didn't see, and we were happy to include this better, more thoughtful language. Or upon further review, we felt the language previously in the plan best reflected the intent of this committee, and so didn't accept the change, right? We'll give a little bit of a reason why, and then we'll make those changes collectively. So that's kind of what we'll do with the specific feedback versus the general feedback. You'll get a big temperature take so that you know whether we as a group feel comfortable moving forward on some of the temperature take questions, and then to the extent that we get specific requests, whether they be from multiple people or it be from someone we feel we want to listen to. And also, one of the things we discussed in the core planning team is, to the extent that we know, we won't necessarily let you know the exact person that made the comment, but if we know it was a youth and family, or a youth or family that suggested a change versus, an agency director, we'll put that on the page so that can be a part of the conversation. There's no strict weighting process, but to the extent that that weighs into whether we want to accept the comment or not, there will be opportunity for that. Does that feel fair, pretty good, not too bad? We're going to try really hard to tackle as much as we think we can with the smaller team if that becomes necessary, so we don't have to have a 12-hour meeting going page 1, page 2, that kind of thing.
And that will be our December 2nd meeting.
Correct. And then what I will do with that, I will chart and will say, what did they say? Who generally said it? What was our response? We will create that chart, and then it will become one of the 9,000 appendices also attached to this, so that if anyone wants to make sure we took public comment seriously, they can go see, here were the people that felt this plan pretty much reflected what they wanted. Here are the number of people that said it was the bee's knees, and we had 15 suggested changes by multiple people. This is what we decided about those changes. So that'll also become a part of the record, which is, as Christy was sort of alluding to, good practice for a government agency that wants to be thoughtful, transparent, getting feedback. Sound okay?
Kidding.
No. It was like, start all over. I'm the first one to know that this is. Oh my gosh, I would love that. I would not.
Page by page.
I know, I was noticing.
Don't make it sound cool, because you're gonna make me want to do it. Not, I don't like the plan because I like.
Chris
Can't share it all at once.
have been having this unknown battle that I don't even think she knows that we've been having, where she likes each section to start on its own page, and I'm trying to make it shorter. So she keeps putting page.
No, it has to be separate for readability.
You're right.
Yes.
No, but I'm so afraid.
You can't put those page breaks in until the
For us
very
to
last
like issue
section.
a document and everybody.
Okay, that makes sense. That I'm okay with.
That's my worry. I'm like, nobody's gonna read
If people who are being paid to read 40 pages won't read 40 pages, then that's their fault.
So anyway.
Someone who's read
each
40
one
pages.
is on its own heading, and we've rolled in with a very, very long document that is high quality, etc. Okay, so.
Aren't you guys excited about the implementation plan?
Yeah, that's where we're going. I'm getting us
Like,
there. I'm getting us there. So, calling the question, is there anyone at this point who is uncomfortable with us sharing the plan as it stands? It will have the edits that we discussed today and the edits that the data committee made last week. Anyone? Yes.
The last thing that I found for what Annette said about youth life skills, page 20, goal 1, strategy 1, 2, and 3, those would be the best to put
You got
that as an action step.
Thank you. I will.
Yes, page 20, goal 1, strategy 1, 2, and 3. Youth life skills would be best implemented as an action step under one of those 3 strategies.
And we have some folks in the chat throwing in some ideas too about what that action step could say. So it looks like people are trying that. So we'll get that plugged in on the plan. Obviously the pre-printed plans, you're not gonna see it, so don't hold it against us. We're good, but we're not that good. But thanks for doing that sleuthing work, and we'll keep wordsmithing it.
And you are welcome to hear if you are in that goal 3 group to like write it down, right? Or anyone else who's like, oh, I see those lights and lives, put it down.
So I just want to be crystal clear, this is the moment online and in the room. If I don't hear any objections, then we're gonna move forward with putting this out there for public comment. Okay, great. Woo, man, I'm so proud of all of you.
That's a big deal. It doesn't feel like, that's a big deal, folks.
All right, now everyone get in the middle. It's dance battle time.
Okay. So here's what's next. This is like, I cannot tell you how excited I am about how big these printouts are. I'm such a dork. Okay. So in the room, we're gonna break up into two groups. And online, as soon as I'm done talking, we're gonna break you into 2 breakout rooms as well. Here is what folks are tasked with, and we'll type it into the chat also as we have a second room. I'm just looking at my very helpful folks to do that. So you have in front of you the implementation plan, right? You've all seen it. We sent it out before. This is like,
Did we get that one?
oh yeah. That's what I'm excited about. Each group is gonna get one. Well, in the room group, sorry team online, should have come on in. Perfect, thank you, Virginia. So, this is like the rice that goes under the meat and potatoes, or like the mashed potatoes under the meat and potatoes, and the rice under the broccoli and tofu.
You're gonna say rice under mashed potatoes, like, you know?
I know, I got it wrong. In my head, it's looking. So, here's what I really am gonna want folks to focus on today. The SOCAC sponsor, and the due date, and the notes, okay? So you're gonna see, you've seen this. I've circled it on this one, I'll circle it for the other table too, for those online. SOCAC sponsor, the due date, and the notes. So let's talk about what each of those things mean, and anything that you see in any of these columns is a suggestion that you can trash. So take it or leave it, you don't have to follow any of it. SOCAC sponsor, so this is, you can hear different personalities. This is the cat herder or the cheerleader, depending on who you are. This was our conversation this morning. It's who on council, so it has to be a person on council, is tracking the progress on the action items. They don't have to do it, right? You don't have to be the one that makes the thing happen, but you're the one that 2 days before the next meeting calls whoever the lead is that will be identified, which will be experts that staff identify, like calls the lead and says, hey, we're meeting in 2 days. Are you ready to show up and report out because our item is up? Or who calls in between and says, hey, the data team told me the X, Y, and Z. I'm wondering if you're coming in because we need to hear from you, right? You're the liaison. And sometimes it means you're the one that calls and is like, have you done anything in 3 months? Because I haven't heard from you, right? This will be really important. One of the things that came up over and over at our retreat was accountability, both little a and big A. This is some built-in accountability to each other and then to this plan. So you're
saying we have to agree to that? Or can we just recommend somebody?
It's like you read my mind. That's exactly what I was gonna say. For today, you are volunteering someone. Now we'll bring it back, right? And you'll get to say, yes, I'm so thrilled, or fine, I'll do it, or please pick someone else, I really don't feel comfortable. But for now, your assignment is to think who's on, and we're gonna put a list of who's on council that we think is the person that's gonna keep us on track on this. Remember, they don't have to do the work, they're the person cheerleading or herding cats, depending on optimist or pessimist or other, right?
Addie, question.
Yes.
When we're thinking of who on council should be doing this, should we be thinking of the person or the role and representation that they're in, because council can change?
Great, person.
Okay.
Person. And like, if it's a like, make sure the data dashboard's up to date. You may be thinking, well, Andrew is head of the data committee and probably still gonna be head of the data committee, so I think it's Andrew. Or your reasoning could be, Andrew really cares about data, so we're gonna make it him regardless, right? Like, you don't have to show your work on this one, you just get to follow and tell.
Show your work. Show your work. If you pick my name, show your work.
Due date. So on the due date, we're picking years here. It's not like July 17th, 2027, right? It's 26, 27, 28, 29. All you're thinking through is what year do we want to have this completed by? Not started, completed by. I'm gonna warn you, I've done this with a lot of groups. It cannot, and this was in your email, it cannot all be 2026. It's gonna feel that way. So I really wanna challenge you to think through, is this something, one, we're ready to start next year? And two, something, when I look at this whole list, that needs to start next year. Because they can't all be 2026. And you can write that in the due date column. And then the notes column, there's varying levels of space for you. You can do arrows, you can pull up a document. Tell us what you want the team to know about this. So, for example, create funding and program that support peer support providers, right? This may require legislation, blah, blah, blah. We have in the notes already limited amount of peers. Create a pathway to train those who are being served to become future peers. I'm guessing Annette has some other things she wants to tell me about what our peer support workers should look like and how we want to get that done. Today is one of many opportunities, but write me some notes about that, right? Like, don't reinvent the wheel. Here's a program I really like you should look into, or please make sure they're not all the same people they've always been. Whatever it is, you give me notes, so there's no limit on what the notes say, how long the notes are, but you tell us what you want us to know, so that a year from now, when Annette's no longer on SOCAC, which is tragic for me and for others, we'll still have her wisdom here in the document to guide us, right? So, sponsor, due date, and notes, and then we're gonna divide you. You're only gonna have to do one of the goals. So why don't you all, as the adults and professionals who are, put yourself into two nicely mixed up teams. And then you guys online, we're gonna split.
I've already split them up.
Okay, we're gonna split you up, and then once you're split up, I will assign goals to teams. So take a minute and physically move.
What we don't have
to
is
corners.
folks in this room who will facilitate in that online space.
I'm hoping that groups will be able to just have group conversation. I wasn't planning on super facilitating that.
Okay, great.
People
So
can
we
talk
have
through it.
council members in each room, council members, y'all are leaders. Governor appointed, recognized background check leaders. So lead in that.
As far as you know.
The version you printed here, this does not look like it, does it have? So Emily is asking for a version with columns for the sponsor due date and notes.
Yeah, the one Karina pasted into the chat was not the right one. We are looking for the right one, but I think it's this on my computer, and I'm also the one doing all the sharing, and so
I found it.
Christy found it. She will post it in the chat for you voluntarily. That's fun. Hybrid meetings are actually.
All right, so you guys go ahead and move into two groups, one corner and the other corner. Those of you online, we're gonna pop you into rooms, and then we'll put into the chat of each room what goal they have.
Yeah, so I'll show you join room button and
perfect. Yes.
Ooh, that was loud. That was so much loud.
And then I did not assign like Adam, Alicia, Annette, Christy, Corinna.
Who wants to be up there corner, back there corner? Which corner to be?
We just be in one group?
You know, like.
This corner, that corner?
Yes, that's what all this in one group.
What about stuff?
Okay.
We're gonna do this for, what was your 45 minutes?
I like it.
And it's like, you can be doing it.
Thank you.
I cannot
Can anybody hear me? Is it possible for you to repost the information on what we're supposed to, the 3 questions?
Which is, yeah, first time that was out.
Yeah, I'll do that in a second, Hillary.
Thank you. No one in our room has them in room number 1.